just as there's a gap in care, there seems to be a gap that's opening wide in this sector of the health field as well. So how do you keep that from just reproducing our old problems just with new machines?
Well, I think, history tends to repeat itself. And here we have a government that has put forward this new high-tech act for health information technology. And we have an Obama administration that's put together an Office of National Coordinator, an Office of Minority Health, and very interested in focusing on that digital divide and working with the minority providers and the clinics that you mentioned. But the reality is that there's always this disconnect, I think, with the leadership of these different institutions. And until we have the people inside the communities that understand the strategies and solutions needed at the leadership decision-making in different institutions, things aren't going to change as fast. So I think one of the policy that needs to be changed really is putting more, let's say, Latino community people, consumers, as well as providers and business people that understand the connections in the community, to put them at the table in different leadership positions and create models that can be evaluated, demonstration projects in our minority communities with the safety net providers like the clinics and hospitals and doctors in those communities that can then be replicated around the country.
That doesn't address the fact that they just can't afford to invest up front in all these new technologies. Often technologies that are quick obsolescence technologies. You're buying a machine
Right.
that you know is not going to be with you for 5 or 10 years, but may be outmoded in 3. And I'm not sure that every minority healthcare provider is going to rush into their procurement department and say, let's get on the bandwagon.
The resourcing issue is huge. I mean, there's the hardware, and pretty much hardware lasts about 3 years now. That's not the biggest challenge because that's not the greatest expense. It is a provider with little resources having 18 vendors walk in the door saying, have I got a deal for you? They didn't go to school to understand technology. And that really is the point of the regional extension centers, to provide that support, especially for providers who aren't attached to large institutions. Many physicians are now. So the large institutions are kind of handling the technology. But if you're a primary care doc out in a community health center or on your own, what do you do? And this really hits minority doctors who say, why, number one, if I have the resources, how do I know what to invest? And I'm a little suspicious. Maybe this is just a flash in the pan and it'll go away. Older physicians especially. So while the regional extension centers don't provide financing, they do provide a number of strategies. One thing that's really helping is instead of having to invest in a software, you subscribe to a subscription that gives you all of the services you need to be qualified for meaningful use, but you're paying a couple $100s a month without having to buy a $26,000 package with maintenance and that kind of thing. The regional extension centers and others in the industry are trying to find a way to make it more palatable for physicians who are both overwhelmed, suspicious. They're saying, meaningful use, what is that? What more paperwork, patient-centered medical home, CMS wants me to do what? Wait, they're going to penalize me in 4 years for what? I mean, if we want to keep any physicians in the industry, a lot of these kind of strategies to make it easier, to make it happen without that front-end investment are being developed.
So cost is an issue. It's a barrier to adoption, but there are programs in place to be able to ameliorate and reimburse some of those costs. For those involved in Medicare, if they adopt within a certain time frame, they get $44,000 of reimbursement. For Medicaid, it's $63,000. So there are ways to be able to ameliorate the costs. Things like what we're doing with Quest Diagnostics and MedPlus, to be able to donate 85% of the costs up front for those providers, ameliorate the cost issues. But I think, and the technical assistance is important as well, but I think the biggest concern that a lot of these folks have is the disruption to their practice. It's disruptive to be able to adopt and to actually go through the process of transitioning from a paper-based practice to an IT-based practice. So I think the more that we can do to be able to help those practices go through that transition, that's what we're trying to do with the HIMSS Latino initiative, working collaboratively with organizations like Elena's and others to be able to reach into these communities and be they Hispanic doctors or not, be they doctors that are serving primarily Hispanics, figure out a way to be able to help them through this transition process and actually move forward in a way that's not destroying, because these are all small businesses, right? So we've got to make sure that they understand what the total cost of ownership is, and they understand what the reasonable rate of return is going to be in terms of recuperating the investment that they've made. So at least it's not a negative drain on their businesses.